This video is called Typical 30-Year-Old Patient. I get a lot of young people sent to me, and a lot of friends send their young adult patients to me, their family members or their friends. I let them talk to me for free, because they're friends. Okay, so anyways, this is just like a typical 30-year-old guy I had to talk to recently, and this is the kind of stuff they run into. This is typical young man behavior. Patient, doc, I gotta know what's wrong with me. I got these episodes of dizziness and I'm spacing out. I'm getting headaches. My neck hurts. I don't feel right. Sometimes my balance is a little unsteady. What's wrong? I said, how's your sleep? And he says, I'm only sleeping 4 hours a night. I go, well, that's not acceptable. I mean, you're supposed to be getting 7, 8, or 9 hours a night. You need to improve your sleep. He goes, well, I've been really stressed out. Work right now is difficult. I got some money problems, and I just got to deal with it, but it's a lot for me to deal with. I said, well, you need to organize your life so you can get at least 7 hours of sleep a night. Okay. And he says, well, it's not the first time this happened. He says, there's been lots of times over for a whole decade that I only get 4 hours of sleep a night. I said, okay, fine, but you're getting older. You're more fragile as you get older, so you got to be careful. You got to get your sleep. The older you get, the more fragile you get, so the better your health habits have to be. Okay? And he says, yeah, but what about the headaches? Do you think I got a brain tumor? One of my friends said it could be a brain tumor. I said, you know what? I'm a neuroradiologist. I look at brain MRIs every day. And you know how often I see a symptomatic brain tumor? I'll see a symptomatic meningioma, once every couple of months. Most of them are asymptomatic and tiny. Nobody even knows they're there. How often do I see a symptomatic brain tumor? I'll see one, every couple of months, a metastatic cancer to the brain, like lung cancer metastasized to the brain. I only see a primary brain tumor, like what one would see in a young person like yourself, once every 6 months, if that often, glioblastoma multiforme, in terms of like a symptomatic primary brain tumor in the brain tissue, the brain parenchyma. It's so rare, it's not even funny. It's the least common cause of headache. You don't even want to consider that until you've excluded everything else. It's that rare. And he goes, well, my neck hurts. My neck hurts sometimes. I think it's from when I was lifting weights, when I was bench pressing, I hurt my neck. I knew that's right when it happened. And I said, okay. He goes, do I need a neck MRI? I said, do you think you need surgery? And he says, no. And I go, you were playing basketball, you told me just the other day, and everything was fine after your so-called neck injury. And he goes, yeah. I said, okay, fine. Well, you don't have any numbness, tingling, weakness in your arms or legs? No. Difficulty walking? No. Okay, the pain's improving, so you don't have a worsening neurologic deficit or pain. You don't need an MRI, okay? MRI of the cervical spine is for people who are considering surgery. You don't want to just be getting them for the heck of it, okay? And he says, but I do have these episodes where I'm not fine. I said to him, do you ever drink alcohol? And he goes, yeah. My friends and me, we go out and we party on the weekends and we have some drinks. I said, you shouldn't do that anymore. And he goes, I've been going out on the weekends and drinking ever since I was in high school. It's no big deal. I said, it is a big deal now. I said, when you're in high school and you're drinking on the weekends, you're a juvenile delinquent. But when you're 30 years of age, you're middle-aged now, and you're drinking on the weekends, it means you're an alcoholic. You shouldn't drink anymore. You should quit alcohol completely. He's like, well, no, doc, it's part of my social life. I'm not going to stop socializing. No way. And I go, well, try to learn to socialize without drinking, okay? There's nothing good about drinking. You poison your brain cells every time you drink. And it adds up over the years. You've been doing it now for over 12 years. You keep doing it, you're just going to get stupider and stupider. Your brain's going to shrink. Alcoholic's brain looks pickled. And I said, I think you're an alcoholic. It's not normal to drink every weekend. Just because you and your friends are a bunch of idiots, that doesn't mean that it's normal to do that. You should not be drinking on the weekends. I haven't had one sip of alcohol in probably about 30 years. I had like one sip of alcohol 30 years ago. When I was dating my ex-wife, she told me I had to drink in front of some of her relatives. I had to have a sip of beer, otherwise they would think I was weird. That's the last time I've had any alcohol in my body. Okay, and I said, you're not in high school anymore. You need to stop drinking. And he says, and I said to him, how's your diet? And he goes, it's good. I eat clean. I said, oh yeah, what do you eat in a typical day? And he says, well, for breakfast, something like coffee, a little milk in the coffee, and then I'll have a bagel. I usually have a boiled egg or, a fried egg, scrambled eggs or something for breakfast. For lunch, oatmeal, bananas. But sometimes I'm busy and I'm in a hurry. I forget to pack lunch and I just have fast food for lunch, like takeout, I'm in a hurry. And I said, oh yeah, okay. And I said, you eat out of like those black plastic containers that they put takeout food? And he goes, yeah, that's what they put it in. And I said, you realize that it's made from electronic plastic that's recycled, it's got flame retardants in it, it's full of toxic chemicals. You should never eat anything off of that, especially not heated. He goes, oh, I didn't know that. And I said, well, don't do that anymore, okay? And he says, at night, I a lot of times I'll have pizza, but it's just cheese pizza. I don't eat the sausage pizza anymore, and I'm trying to eat more plant foods. I do eat some fish. Fish is healthy, right? And, I often have a beer or two. I like organic bread, dipped in olive oil, a little bit of chicken. And I said, all that stuff is bad for you. You want to be eating plant foods, okay? Substitute beans for the chicken. No more oil, not one drop. And I said to him, look, do you want to get better? And the patient goes, yeah, I want to get better. I said, well, you have to change your habits. You already told me you don't want to stop drinking. Are you going to quit the coffee? Are you going to improve your sleep? Are you going to start eating primarily plant foods, low-fat plant foods? You have lots of unhealthy habits, and you're not an 18-year-old, spring chicken anymore. You're getting older. You have to improve your habits or get used to being sick. There's no medical, surgical bullshitology that can change that. You are the one in charge of your health. You have to change your habits. Patient, what are you talking about? I'm just doing what I've been doing the last 12 years. And I said, that's right, but you're not 18 years old anymore. You're more fragile now. You have to improve your habits. You're accumulating chronic damage to your brain, your spine, and other parts of your body by drinking alcohol, by not getting your sleep, by drinking caffeine, by eating this lousy, high-fat, animal food, processed food diet. Okay, you're addicted to stimulants. Caffeine is a stimulant. I said, I got a whole bunch of beginner videos on my YouTube channel. You're welcome to watch them. But you need to change. You need to recognize that you're screwing up, because until you recognize you're being a screw-up, you're not going to fix it. Okay, I don't got all day to talk to you. I've told you what you need to do. You have to quit the coffee, quit the caffeine, get 7 to 9 hours a night of sleep, start exercising again, eat almost entirely. I'm 100% low-fat vegan. You should be almost entirely plant foods, organic only, no processed foods, no oils. You got to filter your water with reverse osmosis, okay? There's a lot of stuff you can do to help yourself, but you have to do it. There's no magic pill. There's no, I can't do a rain dance and give you a cure. You've got to make the effort. You're in charge of your own health, and you have to be willing to do it, okay? I can't push you up a ladder. You're fat. You're an alcoholic. You're addicted to stimulants, and you're sleep deprived, okay? And you're stressed out. I can't change that. You can manage your stress better. It's good to be religious, and you have to simplify your life so you'll have more time for sleep, okay? These are things you need to do, or get used to being fat and sick, and it's only going to get worse if you don't start turning it around now.